Hi, this is Dr. Guy Furno again with Think TV, True Health, Integrative Nutrition and Chiropractic. And I'm here with Anthony Genova. Anthony's been a patient for not too long, maybe about 8 months or so. But he had a lot of problems when he came in. His daughter was originally coming in, and she's been trying to get her dad here. He actually doesn't even live in state anymore, so he's kind of traveling and to get here. But he had some major issues with Crohn's disease. I'm going to just let him tell the story, and then we'll go from there. So,
yes, I was diagnosed in 1995 with Crohn's, and in 1999 I went through a resection of my small bowel, as you know, and it was a tough surgery. I went down to about 99 pounds, and went on a heavy medication regimen for about a good 15 years, 16 years, and then had another resection. And then my daughter Laura said, "Gee, Dad, you know, after all these medications, it's like a trial and error type thing. Maybe you should see Dr. Furno." So I decided to meet you. And I've got to tell you, not because you're sitting here, you changed my entire life. My regimen is much different with my diet, but with the supplements that you've given me and the guidance, and I'm on the right track. What does that mean? I was on a drug called Humira, which is heavily advertised on television. This particular drug...
nasty one.
Yeah, it had some nerve damage on my left foot, my left hand. I had a shot 3 o'clock in the afternoon. That night I find myself in the hospital about 12 midnight on an IV. A couple days later I got the feeling back in my hand and foot. And my doctor and I went through it, and he wanted to switch me over to another drug, and that's when I stopped. And then my daughter said, "Dad, you have to see Dr. Furno." And that's when I engaged you, which was a couple of months back. And since then, I've been on all the regimens, and we went through, I guess, 3 or 4 different adjustments.
Yeah.
So I'm actually, as of yesterday, May of 2018, I'm actually off.
Off some of the stuff we started with originally,
yeah, some of the things. And you know, now it's just the diet thing, which I've stuck to. One thing I have to say about Dr. Furno, he has a tablet, a sheet of paper that you just notate what you eat. And being a Crohn's patient, this is commonly done by gastro doctors where they want to know your history when you see a nutritionist. But many of the things that were eliminated from the diet, specifically me, were the grains and the wheat, and no more soda, no more meat, no more pork, and a heavier regimen on things that come from a farm. And it's changed my life. I have normal bowel movements, 1 or maybe 2 a day.
That was normal, not no.
Yeah.
Which,
yeah.
I mean, originally normal. It was kind of, the idea of having a normal bowel movement for you at this point was kind of almost a medical impossibility.
Yeah. There's a thing called the distal ileum, which is in everyone's body, which is basically a flap between the small and large intestine. People with Crohn's disease have issues in the small intestinal tract, which basically gives you the nutrition that you're required to have to live. Colitis is the large intestine, but in my particular case, that particular area, the distal ileum, was taken out in 1999. So you struggle with this every day, and the diet that I was on, and now the diet that I'm on with Dr. Furno's recommendations, it's second to none, because it's a different way of life for me. It's totally out of the ordinary for me. A typical day for me, prior to meeting Dr. Furno, I knew where every good bathroom was, let's say on Jericho Turnpike from Smithtown into Nassau County, which is not a good thing to know. I shouldn't be focusing on where to find a clean bathroom to go. And that could be 9 or 10 times a day with a typical Crohn's patient when it's active. Now it's dormant. I'm sticking to the diet because I don't want to be sitting in a hospital with IVs in me. And you're sitting in front of someone, Dr. Furno, where they ran out of places to put the IV. I spent a month and a half in the hospital in 1999, and it wasn't fun. So thank you for the help that you've given me and the guidance, and I'm sticking with what you did for me.
Well, these are my wins when I hear that. I mean, how many feet of bowel did they resect total?
I have 4 feet of my small intestine remaining.
That's a lot of bowel gone.
That's a lot of bowel going. I used to carry about 220. I'm about 180. But I'm in good shape. I play golf. I'm active. I can walk. I can walk without a cane.
Right. And most of these, when you have these Crohn's patients and so forth, what you were talking about before, as far as having your bathrooms along the routes and everything else to go through, that's typical for most of these patients, because they don't expect them to normalize their bowels at all.
No.
And unfortunately, it becomes this medical miracle type thing, but in the past 30 years, we see a lot of medical miracles that wind up then being called, oh, it's just coincidence.
Right.
I don't know how many times it have to happen before it's not coincidence anymore,
Right. Well, the Humira drug was the icing on the cake for me. But prior to that, I was on a drug called prednisone, and what a deceiving drug. I mean, it really distorts your appetite, where you get abnormal appetite. Your face begins to blow up. You could lose hair. Your skin becomes discolored. You have attitude changes. It's a terrible drug, but it's also commonly used for inflammation purposes. Now,
Yeah.
Humira has taken its place. Now, listen, it may work for some people, but obviously it didn't work for me. But you name
A lot of side effects.
tremendous.
Which really aren't side effects, they're effects, because there are no actual side effects.
Right.
This is what the drug does to you.
It's a shame. It's really a tough drug, and listen. All I can say is that I'm sticking to your regimen that you recommend, and it's been great for me. It's just a world of difference for me. It's a world of difference.
And just point of clarification, we're not treating him for Crohn's, we're not treating him for colitis, we're not treating him for really his bowel issue in a sense. Medicine, traditional medicine, basically treats symptoms in numbers. You come down with a symptom, you have a certain number that's out of range, they're usually giving you some type of drug to change that number to what they think it should be, or to mask over or cover up the symptom, but not necessarily getting to the reason why. And if that's not working, then it leads into surgical procedures. I mean, so you've been through the gamut of this whole process. On our end, what we're looking to do is just strengthen the body to restore its natural ability to heal, regardless of what the condition is that's going on. So it's, these bodies are amazing things. They always heal themselves. We just try to facilitate that.
I think the tremendous thing for me is in the adjustment in my diet.
Yeah.
And I mean, I teach people how to buy at their first home. I've written a book on it. But one of the biggest things is someone's budget, and also how to develop good habits. And I think the biggest thing is, I don't think you ever get rid of a bad habit, you just replace it with a good one. So Dr. Furno basically has taught me that in my own way, to replace these bad eating habits with good eating habits and good food choices. And that's really the key. That's
Excellent.
really the key. Yeah.
So, wonderful. Tune in again for our next episode with whoever we bring in. Remember, if you have any issues, you have any questions, please call the office. You can find the numbers attached to the links. If you are out of state or somewhere else in the country, don't hesitate to call either, because we do have practitioners throughout the country. All right, great. Thank you. Thank you, Anthony. Have a great day.
Thanks, Tom.
Okay, bye.